got to speak with her daughter, who, despite what she's going through, was still forgiving, but she wants those persons who fail to care for her mommy to be dealt with to the fullest extent of the law, But that now brings us to this point that I want to raise. The government needs to put in place patient care advocates at the hospital. I don't know how we do this. I don't know if the government needs to do it or if we can get a private agency to do it, putting in place patient care advocates at the hospital who will make sure that patients are being cared for, that they're not being abandoned, not just being left on the bed, that they will agitate somebody. Listen, I need you to go and deal with so-and-so. So-and-so is crying out in pain, what's an ever, and so forth and so on. But we need these kinds of things. And then, we heard the complaint of some of the places not having medication and stuff like that. The government needs to be much more vigilant in that process. But we desperately need patient care advocates, people who are concerned about people who end up in the hospital. Because sometimes, especially if the family is not, because here's the thing, family members are not allowed in the hospital. And so when somebody goes into the hospital, they're basically left alone, and they're only allowed to see people when the persons can visit them. Now, there are some persons who can pay for private wards or private units where they can get private care, but the problem is that's a very expensive process. So everybody ends up on these public wards. If you have a patient care advocate, that patient care advocate can act as family at times when families are not allowed in the hospital, and then when visitation comes around, the family comes and do their things and checks on their relative. But the patient care advocate makes sure that regardless of what's going on, 24/7, those persons are being cared for. Somebody's looking into their issue. The nurses are paying attention. And if the nurses are not paying attention, if the nurses are not aware, they bring whatever's going on to the nurses' attention. We need a system like that at the Princess Margaret Hospital to stem the tide and stuff of these deaths that are taking place in the hospital in a negligent fashion. It is very concerning. Patient care advocate is what I think we need. And I'm sure that there are more things that can be done, but for now, let's start with that. All right? Now, somebody sent me a message, a troubling message about the young 10-year-old who died in Blackwood, Now, remember we had about 3 children die in separate incidents. I think that was last weekend, and it was really troubling. And let me read the story from Earl Boleg in the Tribune. He says, 3 children died in separate weekend incidents. The new year opened with tragedy for the families of 3 young children who died in separate incidents over the span of 3 days, prompting police investigations and widespread public concern. The youngest was a 3-year-old girl who fell ill along with her 4-year-old brother at a residence in Nassau Village early Friday morning. They were taken to Princess Margaret Hospital at 3 a.m. by their mother in a private vehicle.